When it comes to cancer, catching it early can make a monumental difference in treatment outcomes and survival rates. However, amidst our busy lives and the myriad of health advice floating around, it's easy to overlook the subtle signs our bodies might be sending us. Think of these early warning signs as your body's way of whispering before it has to shout. That is why in this video, we're going to break down the most common early warning signs of cancer that, while often benign, could also be your body's early alert system indicating something more serious. This isn't about inducing panic, but fostering awareness. It's like noticing the check engine light on your car's dashboard. It's probably nothing too serious, but it's worth checking out just in case. Number 1 on our list is unexplained weight loss. Unexplained weight loss, particularly losing 10 pounds or more without a change in diet or exercise routine, can be an early warning sign of cancer. This symptom is most common in cancers such as pancreatic, stomach, esophagus, or lung cancer. The weight loss occurs because cancer cells compete for nutrients, often at the expense of the body's healthy cells. Additionally, cancer might influence metabolism or cause the body to react by reducing appetite, leading to a significant reduction in weight without effort. It's a signal that the body is not functioning normally, prompting further medical evaluation. Number 2, fever. Fever in the context of cancer often indicates that the disease has spread from its original site, affecting the immune system. While fever is a common response to infection in cancer patients, it can be the result of cancer cells triggering an immune response. Particularly prevalent in cancers like leukemia and lymphoma, fever may be a persistent or intermittent sign that the body is fighting against malignant cells. It's also common for fever to manifest more frequently as the cancer progresses. This symptom alone can be vague, but when associated with other warning signs, warrants a closer look by healthcare professionals. Number 3, fatigue. Fatigue associated with cancer is not just ordinary tiredness, but a profound and persistent sense of exhaustion that rest cannot relieve. It's one of the most common symptoms experienced by people with cancer, impacting daily life significantly. This type of fatigue can be due to the cancer itself, such as when cancer cells consume a large portion of the body's energy resources. It may also result from the side effects of cancer treatment, including chemotherapy and radiation therapy, which can deplete energy levels. Unlike regular tiredness, cancer-related fatigue doesn't improve with rest and can be overwhelming, signaling the body's struggle to cope. Number 4, pain. Pain as an early warning sign of cancer can occur in various forms, depending on the cancer's location and stage. For instance, a headache that does not improve with treatment may indicate brain cancer, while back pain can be a symptom of colorectal, ovarian, or pancreatic cancers. Initially, the pain may be intermittent, becoming constant as the cancer progresses. It results from cancer cells invading or putting pressure on nerves, bones, or organs, causing discomfort or pain. Early cancer pain might be mild and overlooked, but persistent pain without a clear cause should always be evaluated by a healthcare professional. Number 5, skin changes. Skin changes can be significant early warning signs of cancer. These changes may include darkening, yellowing, reddening of the skin, sores that do not heal, changes to existing moles, or the appearance of new, unusual growths. For example, melanoma, a type of skin cancer, can manifest as changes in mole size, color, shape, or texture. Non-melanoma skin cancers like basal cell carcinoma and squamous cell carcinoma often appear as a persistent sore or growth that doesn't heal. Additionally, cancers like breast or liver cancer can lead to yellowing of the skin or itching. Any new or changing skin lesions or abnormalities should prompt a medical evaluation. Number 6, change in bowel habits. Changes in bowel habits such as persistent diarrhea, constipation, or a change in the size of the stool can be early indicators of colon cancer. This symptom may also include a feeling that the bowel does not empty completely after a bowel movement. Occasional bowel changes can occur due to dietary changes or minor health issues, but when these changes last for more than a few days, they can signal a more serious condition. Blood in the stool, another alarming sign, may appear as a brighter red or darker tar-like consistency, indicating potential cancerous growths in the colon or rectum. Early detection through screening may significantly affect the treatment outcome, making it vital to report these changes to a healthcare provider. Number 7, sores that do not heal. Sores that do not heal can be alarming, as they might signify an underlying cancer, particularly in cases where sores appear in the mouth, on the skin, or the genital area, persisting beyond the usual healing time. Oral sores might indicate oral cancer, especially in individuals who use tobacco or consume excessive alcohol. Non-healing sores on the skin could be a sign of skin cancer, necessitating a thorough examination for changes in size, color, or texture. Similarly, persistent sores in the genital area might suggest cancer related to human papillomavirus infection. This symptom underscores the importance of seeking medical advice for sores that linger to rule out cancer or receive early treatment. Number 8. Unusual bleeding or discharge. Unusual bleeding or discharge from any part of the body can be a troubling sign of cancer. For instance, coughing up blood may point to lung cancer, while blood in the stool can indicate colon or rectal cancer. Women experiencing abnormal vaginal bleeding or discharge might be facing signs of cervical or endometrial cancer. Similarly, blood in the urine may suggest bladder or kidney cancer. This symptom requires immediate medical evaluation, as it often indicates that the cancer has grown or is invading nearby tissues. Early detection and diagnosis can significantly improve the effectiveness of treatment. Number 9. Lump or thickening in the breast. The discovery of a lump or an area of thickening that feels different from the surrounding tissue can be a crucial early warning sign of cancer, particularly breast cancer. However, not all lumps are cancerous. Many can be benign or non-cancerous. For women, any new lump or change in breast tissue should prompt a consultation with a healthcare provider, as early stages of breast cancer might present as a palpable lump not visible on a mammogram. Similarly, lumps or thickening in other parts of the body, such as the testicles or lymph nodes, in the neck, underarm, or groin, can indicate cancer and should be evaluated medically without delay to determine their nature and if further testing is needed. Number 10. Difficulty swallowing. Difficulty swallowing, known medically as dysphagia, can be an early sign of cancer, particularly in the esophagus, throat, or stomach. This symptom may start as a mild discomfort and gradually progress to a point where it becomes hard to swallow food or liquids. It can be accompanied by pain or a feeling of food getting stuck in the throat or chest. Apart from being a potential sign of cancer, difficulty swallowing can also lead to malnutrition or dehydration if left unchecked. If this symptom is persistent, it warrants a medical evaluation to diagnose the underlying cause, which may include diagnostic tests like an endoscopy to examine the esophagus and stomach for signs of cancer. As I've mentioned throughout this video, it's important to see a doctor if you experience persistent symptoms or changes in your health that concern you. Early detection of cancer significantly improves the chances of successful treatment, so paying attention to your body's signals is crucial. Therefore, if you notice a combination of these symptoms, or if any single symptom persists for more than 2 weeks, it's advisable to seek professional medical advice. Being aware of the early warning signs of cancer and acting promptly upon noticing any concerning symptoms can significantly affect the course of the disease and the effectiveness of treatment. While the presence of these signs does not necessarily mean cancer is present, they serve as crucial indicators for seeking medical advice. It is our collective responsibility to listen to our bodies and respond with prompt medical attention when needed, reinforcing the importance of regular health screenings and awareness of the signs that our bodies may be signaling.